The installation was incredible. It was seamless. It was not a problem at all. Samsung was wonderful in working. We were trying to do this between patients. My downtime was minimal. I mean minimal. Maybe 30 minutes, maybe 40 at the most. We did not stop having patients come in while this was being done, and we did patients actually that day, and we continued to do them. And digital used to be, GE Digital used to be their point of choice all the time. It has changed since then. I don't know if it's the quality of the image they see, and they're smart enough to know that. They know the doses are, they know their techniques are different. They're a lot lower than they were before, and they like the use of the room. It's incredibly efficient. Patients move through a lot faster. There's a lot less downtime in the room because patients aren't left on the table. The images are seen, they're taken off, the next patient is brought in, so it's extremely efficient. When Ingrid and I went to North Carolina, we loved the system, we loved what we see, but after working with it and listening to the technologist, it's a lot better than we ever anticipated. We knew it'd be good, we had no idea it'd be this good.
I was a little surprised that Samsung had something in the medical to do, and so I went in with an open mind, and when we got there, I was truly blown away. Just seeing the quality of work, the images, just even talking to the technologists there, they were just pleased with how you guys put the equipment together, applications they were great to deal with. So, and then actually seeing the images on their screen and seeing the detail, it was really, I really wanted one. So I was telling Lona, my technical director, that, oh man, I hope we can get one for our facility. After we first got it in, I literally had techs fighting to come into this room. It was just funny just watching a tech, no, I'm doing this one, or I'm gonna get it. And it was all in fun, but they all were eager to come in and work in here. And the other day I even had to I basically sent everyone to lunch so I could get my hands in here and do some patients because I wanted to play with it.
Gorgeous pictures, honestly.
With the old system, I would get the patient into the room, I would have a cassette, I would take the x-ray, and I'd have to leave the room to go out to process the x-ray, which could take about 2 or 3 minutes. The Samsung machine allows me to take the x-ray, view the image within 3 seconds, and then move on to taking more x-rays. We are easily allowed to double our productivity now. The Samsung machine is very good. It's radiographer friendly. A lot easier to use, it's very light, and because we have the access of the remote controls, we can position a tube in the room before we've even got the patient in. The soft handling function is a lot easier to use because we can just move the tube along with 2 fingers.
The main problem with manual setups is that it's very physically challenging, and towards the end of a radiographer's career, they often suffer difficulties with back injuries.
The Samsung XGO is better than what I've used previously, simply because it's got really good dynamic range, really good bony detail as well as soft tissue details. Well, the accuracy obviously is vital to what I do. Having to provide a report and a diagnosis to a patient is key. The Smart Stitch function on Samsung XGO is really useful. Previously we'd have multiple images which were separate, then you'd have to interpret them, allowing for overlap, so the accuracy would be down. On the Samsung XGO it's just one image, which then allows us for better accuracy.
My name is David Poston. I'm Director of Radiology here at McLeod Regional Medical Center. We cover a 12-county area, which includes about 1 million individuals. We perform approximately 220,000 procedures annually. Our department is pretty large. We have approximately 140 employees within radiology. It actually improves the patient throughput by having the 2 detectors from the standpoint that when a patient comes in a room, we don't have to take that time to move one detector from the table to the chessboard. And plus with the Samsung room, which is really nice, with the remote control they can press a button and it automatically brings it up. It's that robotic system that has built into it that our technologists really find fascinating and enjoy working in. So now is the room of choice in the short period of time that since we've installed the equipment. Everything is integrated together with stitching, with the robotics, with image quality, with dose reduction. Probably more excited over this piece of equipment than anything we've purchased in quite a few years.
The image quality has been spot on from what we've heard from our radiologists. They love it. They're able to see a lot more detail that they weren't able to see before. The robotics, the kids love it. That's how I get to X-ray children, and they're absolutely okay with me as I get our little remote and I let them push the button So everything moves and they're amazed, they're not scared of it, and I never have a problem x-raying kids anymore. They love that. You're able to control the room from so many different places. You can control it from the wall bucky, you can control it from this, and you can control it from your remote control. My favorite image is the lateral T-spines. The lateral thoracic spines, they are beautiful in here without a breathing technique. To not have a breathing technique in this room, those images are phenomenal.
The quality is something I've never seen before. On these machines, you can see hair that is thin like mine, so you have to move it for cervical spines and stuff like that, because it does actually show up in the x-ray. You can see it. So just to know that hair as thin as mine actually shows up, just imagine all the other details that we're getting in the image.
Image quality is phenomenal. We get excellent pictures for the radiologist to read. It is so detailed. Even if like you did a quarter person swallowing a quarter, you could actually tell that it was a quarter. It is very, very detailed. So our radiologist is very happy with it, and whatever makes them happy makes us happy. Oh yes, definitely our go-to rooms. We always come to these rooms. We hardly ever use our other rooms just because it's just so easy to use. It's so user-friendly. So we always come to our Samsung rooms first. The S-Line is one of the greatest features. You're able to do a structured chest with no grid lines. So the image quality for the radiologist is wonderful.
When Ingrid and I went to North Carolina, we loved the system, we loved what we see. But after working with it and listening to the technologist, it's a lot better than we ever anticipated. We knew it'd be good. We had no idea it'd be this good.
We have seen just a huge difference in doing our babies because it's so much faster and the detail is just so great. So great that it's dropped our dose down. We can see things like the mattress and the blankets, so we worked with the filtering on that and we're able to take that away. But our central line placements are beautiful. There's no, we don't have to work with the contrast on that. On the first image, it's just awesome. On our adult patients, our portables, we have found them to be absolutely gorgeous. Our line placements, PICC line placements on some of our larger patients, we've always had to make sure we had a grid to even be able to see the line, and now, yes, we still use a grid, but the image is beautiful. You don't have to manipulate it. You're seeing the lung, the heart shadow, and the PICC line placement all on one setting. It's just gorgeous. Our NICU babies who are very sick get a lot of x-rays, or many of them who have ET tubes are x-rayed daily. So we are able to cut that dosage down up to 50%. So that is a tremendous help for these babies that are really sick and are getting so many more images than average. You can see so much more on your image. So you see a chest x-ray, the radiologist can see more anatomy than they've ever been able to see before.
Yes, in our ER we only had one diagnostic room, and a lot of times we would get backed up. So if they, put in for extremities or KUBs, things like that, we would just take the Samsung and just go around and to the patient's room and do it there. That way that would kind of cut down on patient wait time, and they look just as good.
I'll wait for this portable if it's not already being used before I go to shoot, because it does so well and you see so much. The detail's incredible. That's the main thing, the image quality. There's no comparison really.
It's a lot better than we ever anticipated. We knew it'd be good. We had no idea it'd be this good.